I'm Dr. Shijay Joshua I'm a neurosurgeon at Aston Medicity. One very common question which troubles us all is headaches. It is a headache for everybody to have a headache. Why does it occur? That I'd be looking at many aspects of this symptom called headache to, so that we can understand how we can deal with the headache and not ignore the troublesome ones and how to treat them. So, firstly, why do these headaches occur? Headaches occur when you have lack of sleep or alcohol or certain foods which are nitrate rich, high salt, when you have loss of sleep or when there is dehydration, you're not had sufficient amount of water with excessive exercise. And so in those conditions, headaches may occur, but they are all short duration. But when these headaches persist, and when they persist and they are coming regularly, so that's when we would like to meet a doctor, right? Instead of becoming doctors ourselves. So what would the doctor be looking at? So as a doctor, I'll be able to tell you a few symptoms which the doctors look at. So for example, the symptom is what type of a headache the doctor would be asking. So is it coming in the front or the back or the neck? Is it related to certain food, like what I was talking to you? When you're hungry, does your headache come? When you're so all these questions are to find out what is the cause of the headache. Now we can understand the causes of the headache and then go to each of them. So the headaches are divided primarily into two parts. It's either a primary headache or a secondary headache. A primary headache is when there is no other reason for it. For example, one of the most common diagnoses everyone tells is migraine. So any and every headache need not be migraine. Migraine is usually a diagnosis of exclusion when there is no other cause found. So how are these headaches? Migraine headaches are usually side locked. Either it could be side locked, it could be coming on one half of the face, right or left. They last for a few hours. They may be coming in the mornings, and they may be associated with nausea. They're relieved with rest, and there will be certain trigger factors like hunger, chocolates, caffeine, hot sun, stress. These could be the reasons for migraine. The other common primary headache would be a cluster headache or a tension headache or stress-related headaches. They are these band-type headaches, start from the back of the head. It's like a tight band on the head, usually associated with stress and relieved with resting again. So going on to what are the secondary causes of headaches. Secondary causes is when there is some medicines which you have taken, or it is some other cause for these headaches. For example, there is a tumor, there is a bleed. So how do you, so these headaches which are secondary related headaches are quite severe. There's an underlying cause to it. So, the most severe headache in your head, it could be because of a bleed. Now, how do you differentiate as a patient between primary and secondary headaches? The primary headache would be something which is coming regularly, and you know what happens. You've met a neurologist, he's given you a diagnosis. But if this pattern of headache is changing from a primary, from a short duration to a long duration headache, it is becoming increasing in intensity, it's not getting relieved, it remains for a longer time, that's when you need to suspect there's something going wrong. And then you need to meet a neurologist. Is it associated with visual problems, blurring of vision? So those are times when you need to meet a neurologist. Now, to go through some of the causes of these headaches, severe headaches, which come to a neurosurgeon, would be when there is a bleed in the brain. So everyone is concerned, either bleed aavo, brain, bleed aavo. So that is when you have the most severe headache in your life. And when that happens, obviously you need to rush to a hospital. They get the CT scan, and if it's a bleed, there could be multiple reasons for a bleed. One of the most common reason is an aneurysmal bleed, which occurs in a later age group. So like I was talking of migrainous headaches and all, they come in a younger age group. One of the other causes is an idiopathic intracranial hypertension, which is when there is no other cause found and there's pressures raised in the brain. And that is also one of the primary causes of headache. Now, with regard to this bleed, it needs to be picked up quickly. It needs to be treated. How do we do it? If a CT scan or an MRI is done, and even that, if there is some underlying problem, it needs to be appropriately treated. For example, an aneurysm is there, it needs to be either coiled or clipped. If there's an AVM, if there's a bleed, it needs ICU admission, decreased pressure in the brain, anti-epileptics, and all those things. So those are things for the doctor to treat. But from a patient point of view, if it's a more severe headache, if the pattern of the headache is changing, that is when we need to realize that we need to seek help urgently. From the brain tumor part, it is like once we get an MRI brain, if it's a side-locked headache, always my headache comes only on one side. It is more in the mornings. It's associated with vomiting. And after I vomit multiple times, the headache comes down. It is increasing. It is there for a few days, weeks. That's when you need to meet a neurosurgeon and get an MR. And if there is some lesion picked up on the brain, either an AVM or a meningioma, so then we need to start medicines and do the right treatment. Probably a surgery would be required for both of them. So to summarize, headache, if it comes with some underlying cause, for example, I told you certain food, like, we're not eating food, we hunger, alcohol, stress, and then the headache comes. Okay, when you remove these things, when you've eaten, when you're drunk, sufficient fluid, and then if it is going off, then it's okay. But if it happens to recur again and again, you need to meet a doctor, not keep quiet and leave it alone. So it could be something which should not be missed. And if treated appropriately, it can be treated. You will not have any major problems in your life. Thank you so much.